Hello, everyone. My name is Melissa Gonzalez, and my research this semester will be concentrating in suicide health. I hope you enjoy this topic as much as I did, as I discovered many valuable aspects of this topic. So, what is suicide? Suicide is a significant global health crisis. It accounts for almost 800,000 deaths each year, with suicide being the third leading cause of death. I will be researching suicide among 15 to 40-year-old Hispanic females in Los Angeles County. Suicide is the act of intentionally causing one's own death, and the CDC specifies that a suicide attempt occurs when someone tries to end their life but survives. The World Health Organization says that there are many reasons behind suicide that are influenced by social, cultural, psychological, and environmental factors. These are some methodology terms. Since we are doing a mixed methods research topic, I decided to input these here. So integration. Integration refers to how qualitative and quantitative research activities are brought together to achieve a greater insight. So it is in relation to mixed methods research, we use both qualitative and quantitative methods in order to enhance our one research topic. Synthesis is the composition or combination of parts or elements as to form a whole. So the synthesis of our whole paper, the methods, the data analysis, the data collection, the ethical considerations, the validity and reliability of our research, all together are a synthesis that form the best mixed methods type of research. This is my purpose statement. This research aims to investigate perceptions and attitudes towards suicide among Hispanic females in Los Angeles County. This will explore the cultural beliefs, values, influence, attitudes towards mental health and suicide in the Hispanic communities. Public health professionals must advocate and implement a comprehensive support system that allows us to address these obstacles in Hispanic females. They may encounter um, difficulty seeking mental health support or counseling services, and this can contribute to higher suicide rates. Latina women are predominantly more disposed to commit suicide because they are 60% less likely to have received mental health treatment than non-Hispanic white adults. So there is a link between suicide and mental health disorders, and I will be able to explore that. Many suicides can happen impulsively in a moment of crisis. So we will evaluate community perceptions and effectiveness and accessibility of existing mental health services and programs. The CDC states that 12.8 million individuals seriously thought about suicide, 3.7 million have a plan to commit suicide, and 1.5 million actually attempted it. Every 11 minutes, a life is tragically lost by way of suicide, and 50,000 of these individuals have succumbed to this rising public health issue since 2023. These numbers are insanely ridiculous, and we must be able to we must be able to advise adults of the resources that are available to them in order to significantly decrease these numbers. The World Health Organization emphasized that despite the existence of numerous suicide prevention strategies, their effectiveness in real-life situations varies significantly among different populations of risk. Suicide and suicide attempts have serious effects on individuals and their surrounding communities. This is more of an overview of the health problem and behavior. So, the behavior of suicide and suicide attempts have serious effects on individuals and their communities. The survivors of suicide attempts may have long-term health issues that can create a substantial financial burden for themselves and their families. The CDC states that this impact also extends to friends, family, and coworkers because they also are able to experience intense emotions like grief, shock, anger, guilt, and these individuals are left struggling with depression or often end up having thoughts of suicide themselves after losing someone very important in their lives. The World Health Organization states that stigma around mental health and suicide prevents many people from seeking help. The lack of awareness means suicide is often overlooked as a serious public health issue. So, this emphasizes an urgent need for targeted approaches, and this can save many lives. We must dig deep in this public health crisis because suicide can be prevented with the right help and resources. Knowing how to advocate for individuals, even though resources are limited, is crucial. There are problems, there are programs, sorry, that are most effective to ensure someone gets adequate help in the time of crisis. As public health professionals, there is a way that we can enhance these resources for the community. This research proposal aims to investigate perceptions and attitudes towards suicide among Hispanic females aged 15 to 40 in Los Angeles County. This project will assess the level of awareness regarding suicide risk factors and mental health resources within the demographic. The research question I am trying to answer will be, what factors do Hispanic females experiencing suicidal ideation consider when deciding to seek professional mental health and help? And how do perceived stigma, cultural beliefs, attitudes, and access to care influence this decision-making process? It This proposal intends to identify obstacles that Hispanic females may encounter when seeking mental health support or counseling service. Telemedicine and community health initiatives are no longer components of healthcare reform. According to Kitchlew et al., they are essential. There are many strategies for preventing suicide that have been shown to significantly lower suicide rates. Effective and efficient, these solutions have already demonstrated their ability to provide patients with accessible and affordable care. Mental health services are also gaining recognition as an important aspect of healthcare. There are certain gaps in research that need to be addressed. The gaps in research examine not only the frequency of help seeking, but also the underlying reasons for individuals' choices to seek help. Ultimately, it aims to provide more culturally competent, evidence-based interventions. The theories to consider when thinking about suicide rates are the trans theoretical model and the health belief model. According to Gibson and King, the trans theoretical model emphasizes individuals' intention to engage in treatment with a particular time frame. That's where the constructs come into play: pre-contemplation, contemplation, action, maintenance, termination. We can ultimately prevent many suicide attempts from happening. In mixed methods research, both qualitative and quantitative data are collected to test theories and generate them. The stages of change are important to understand because progression from one stage to another is not linear. It tends to be a fluid process. Beliefs about suicide can make it hard for people to seek help. Self-stigma, like feeling ashamed or to blame, it reduces the likelihood of getting help or mental health issues. There's ways to find, it's important to find ways to reduce self-stigma, changing your attitudes about suicide and encouraging individuals to seek help will prevent suicide rates from increasing. Gibson and King explained that perceived severity and susceptibility may shape treatment use among individuals at risk for suicide. Methodology research design involves the intended measures and constructs, and then we can calculate the data collection methods, which are quantitative surveys and qualitative interviews. We will analyze them and their assumptions and limitations, but we must also consider the ethical issues and validity and reliability of our data. For the recruitment plan, we will be focused on community-based and culturally competent recruitment strategies with local Hispanic community centers, churches, and clinics. The outreach recruitment will be done in health clinics with primary care providers. They can provide referrals, and mental health clinics can also introduce the staff to interested individuals. The staff will be female bilingual recruiters, and they will be used to build trust, facilitate rapport, and reduce language and cultural barriers. The outreach staff will train clinic staff to mention the study and introduce interested persons to bilingual recruiters on site. Flyers will be distributed in English and Spanish at community centers, clinics, and supermarkets. And the staff will facilitate enrollment with these individuals either by phone call, in person, or virtual. And they will be providing incentives such as cash, gift cards, or cultural competent incentives of choice. So for mothers, we can provide them baby bags that they need. The sample size will be 15 to 40-year-old Hispanic females in Los Angeles County. That's our target population. We will focus on 10 in-depth key informant interviews, and those 10 individuals will be picked from the quantitative sample size, which are from the 100 closed-ended survey participants that we recruit from our outreach. The data collection will be closed-ended surveys, and in that closed-ended survey, they will have a mental health literacy scale, the suicide ideation questionnaire from UCLA, and this will be mixed mode either by handout, in person, or a web survey. The key informant interviews will be an individual structured interview, and they will be done in person or via Zoom based on the participant convenience. The study will utilize an explanatory sequential mixed methods design where quantitative data collections are conducted first, and then the qualitative data collection will be conducted afterwards with the 10 interviewees to further explore the quantitative findings from the 100 participant surveys. This is effective for exploring human behaviors, such as help seeking in the basis of suicide. I will be working with the health belief model and the trans theoretical model to explore the suicide ideation. And the constructs will be perceived severity, perceived susceptibility, perceived barriers. And the trans theoretical model constructs will be contemplation, preparation, and action. According to Drolet et al., the phenomenon of social acceleration pushes the researcher to think faster and faster and doesn't take time to really see the big picture. This is likely to lead to an unethical bad science that can potentially harm humankind. An important ethical consideration in research affects how studies are designed. We need to minimize harm to participants and avoid any unnecessary physical, emotional, and social distress to these individuals. Mixed methods research serves as both a method and a methodology for conducting studies, and it encompasses a collection of analysis, integration, and it educates the reader about the background of methodology. For this research to be reliable and valid, we must consider how confidently one can draw causal conclusions between two variables. External validity assesses the extent to which the results of a study can be generalized beyond the specific conditions of certain research. Both internal and external validity can be threatened at any stage of research process. So it is important to address these research findings are both reliable and applicable in real life situations. Attrition can be avoided by helping each individual participant with the entire process of the study. Strategies will be mitigated to ensure smooth participation. Thank you. These are my references.